Hi, everyone. On today's podcast, we're going to talk with EBB Childbirth Class graduates, Lisa Mangini and her husband, Anand Swaminathan, about their joyful, high-risk, high-intervention birth. Welcome to the Evidence-Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See ebbirth.com/disclaimer for more details. Welcome, everyone, to the Evidence-Based Birth Podcast. We have an exciting interview lined up for today, but before we get started, I wanted to share some important news with you. The Evidence-Based Birth Professional Membership, where we offer continuing education and a supportive community for birth workers and healthcare providers. We'll be offering a free trial starting July 7th, where you can join for 14 days for free. And then if you remain a member, you'll get 20% off for as long as you choose to remain with us. The option to join the free trial ends Monday, July 18th. So keep your eyes open if you're on our email newsletter list for emails that will alert you when the sale is starting. And with that, let's get to our interview for today. Hi, everyone. My name is Dr. Rebecca Decker, pronouns she, her, and I'll be your host for today's episode. Today, we are so excited to welcome EBB Childbirth Class Parents, Lisa and Anand, to the Evidence-Based Birth Podcast. Before we interview Lisa and Anand, I want to let you know that we will mention miscarriage. If there are any detailed content or trigger warnings aside from that, we'll post them in the description or show notes that go along with this episode. And now we'd like to introduce our honored guests. Lisa Mangini is a writer living in central Pennsylvania with her husband, Anand, and their young son. Lisa teaches English and creative writing at a university, and she's in the early stages of writing a book about becoming a parent. They are graduates of the EBB Childbirth Class with EBB instructor Jennifer Polk, and Lisa and Anand are here to share their story of experiencing a joyful, empowering, high-risk birth with high levels of intervention. We're so thrilled that Lisa and Anand are here. Welcome to the Evidence-Based Birth Podcast.
We're so happy to be here.
Thrilled to be here.
So, Lisa and Anand, tell us a little bit about how you found the EBB Childbirth Class and how you got started on that journey of educating yourselves.
So the story actually starts back in 2019, where I was pregnant the first time, and fairly early on in that pregnancy, I want to say maybe about 6 weeks in, I had a tonic-clonic seizure. Very surprised by this, as I'd never had one before. And so I was put in touch with a neurologist. I had another seizure, I had a miscarriage, and I was really lucky that this neurologist was trained in specifically women's and reproductive neurology. And so we worked with her closely to sort of figure out what kind of risks I might have moving forward if we were to try to have a baby again. And she recommended evidence-based birth for us. And so that's how we found the class. And we're so happy that she was able to recommend that resource for us.
Well, I think that's the first time I've ever heard of somebody finding the class from their neurologist. So that's pretty cool. Tell me a little bit about what did you learn from your doctor and from your education? Did you learn, is there a connection between the seizure disorder or the miscarriage, or how is your condition related to your reproductive health and pregnancy?
And so from what we understand, it sounds like the seizure itself did not impact the pregnancy, and that pretty early on that it was going to be unviable anyway. However, for some people, hormone levels can increase the risk of seizures for those who have underlying kind of seizure activity in their brain already. And so we don't know for sure, but that seems to be something that we suspect played a role.
Okay. So were you going to have to be monitored by your neurologist in future pregnancies, or what did they tell you about? Would you be high risk or not?
Yes. And so before getting pregnant, she recommended that I take 5 times the normal dose of folate for 3 months prior to trying to conceive, because the medication I was on puts me at a higher risk for birth defects, specifically neural tube defects. And yeah, go ahead.
Yeah, and she was really circumspect about what medications she chose, just because there's been very little study on a lot of these anti-epileptic drugs in pregnancy and childbirth. So.
Yeah, and then throughout the pregnancy, I would have to have my medication levels monitored to make sure that I was at the proper therapeutic dose so that I wouldn't have a breakthrough seizure. And usually that's pretty straightforward, but we were kind of chasing the right dose for a while. And so I was getting blood draws like every 2 weeks or 3 weeks to make sure I was getting up to the right dose of that. So those were some of the different interventions and monitoring that that particular condition had for us.
I guess it's kind of interesting too, in that for years you were having these episodes that everyone thought were anxiety or panic or anything like that. And it turns out that actually they were auras that were kind of unmasked by this first pregnancy.
Yeah, that's what I was wondering. So you had your first full-blown seizure while you were pregnant before you had the miscarriage.
Yeah.
But you think you were having symptoms of a seizure disorder like leading up to that, you just didn't realize it?
Yeah. And so there's a lot of overlap there between stuff like panic attacks and the types of sort of like mini seizures that I was having. And so it went undetected for, I want to say something like 8 years. I started having those. And it wasn't until I had that full blown seizure when I was pregnant that we sort of put the pieces together and we're like, oh, I think this is a seizure disorder.
And so what happened next then? You got pregnant again?
Yes. And so it took a little bit of time, not in terms of conception, but just working through different kinds of preparation, right? And so I'm dealing with this new diagnosis of a seizure disorder. I also have a bunch of other stuff that makes me high risk, right? And so, like BMI, I have polycystic ovaries, I have Hashimoto's, hypothyroidism. And so, just a lot of stuff like that, where we wanted to, especially having this really crazy, surprising experience, to just sort through all of that and talk to an MFM and just sort of make sure that we were in the right place on the right medication, all of that kind of stuff before moving forward. So it was probably about a year, I would say, before we tried again, I think.
That sounds about right. After that first surprise, we really wanted to make sure we dot all our I's and crossed all our T's and sought out specialists ahead of time just so we knew we were prepared.
So when you were managing these different chronic conditions and then you get pregnant again, it sounds like you had some specialists lined up. How did that pregnancy go then? What was that experience like?
You know, it's interesting because I was definitely very anxious, just sort of anxious about possibly having a miscarriage, anxious about some of the conditions that could have come up, where I was kind of threatened a lot about like big babies and gestational diabetes and preeclampsia, because that was sort of just assumed based on my health profile. And so there was a lot of that kind of tainting the first half of the pregnancy. But as things went along, it was actually a really great experience, because as someone with chronic illness, it was kind of amazing to see my body be able to grow this baby and to have actually a really uncomplicated pregnancy in terms of medical things that happened to me. So that was really like healing and empowering. And so towards the end of the pregnancy was actually like a very good experience despite all of that.
Mm-hmm. And when your neurologist told you about the EBB Childbirth Class, like how did you go about picking an instructor and what was that experience like?
We were really lucky. Sort of the silver lining of COVID is that the classes were offered via Zoom. And we live in kind of like a rural area. And so Jen's class was geographically one of the closest ones. And I think it was probably still like 4 hours by car away from us. And so that's part of how we picked that out. And we also liked that Jen was an RN as well. And so we thought that that additional expertise would be a nice thing to correlate with the content of the course itself.
Yeah, when you were talking about all of the conditions you were dealing with, I was like, oh yeah, Jen Polk would be perfect for you, because it is helpful to have like an RN who's familiar with all of the physiology and all those things that are going on with the different conditions.
Yeah, she was really great. We enjoyed the class a lot. I want to say 4 different families and just the range of different people in the class, where some people it was their first child, some people it was their second child. You know, I obviously planned on having a pretty medicalized birth in a hospital setting. There was someone there who planned a home birth, you know, so it's just like a really great mix of people in the class as well.
Yeah. What else did you experience taking the class? Was there anything you learned that surprised you or stuck out to you?
I think in general, just the sort of additional commentary that Jen could offer on the stuff that was already in the course, and particularly how she saw some of these decisions play out with some of her own patients. And so that was really great to have just sort of more stories to go along with what the course already talked about.
And Anand, how about you?
Yeah, I think another thing to mention too is that, you know, a lot of the class talks about finding the right care team and the right providers. And pretty early on, I think it was maybe 12 weeks into the pregnancy, you know, we are in a relatively rural area. And so the next closest hospital with a labor and delivery unit is about 55 minutes drive. And pretty quickly, we, for lack of a better word, fired the local facility, and you were dissatisfied with the care you were getting, the tone of the care, and chose to go to the next closest facility to find the right team to take care of you.
Yeah, no, that was huge. And also just sort of a more advanced facility too, in case I needed more additional, just different types of care than the local hospital could offer. The local OB practice was really dismissive, where I'd go in with my very particular concerns and they just sort of be shrugged off. I think one of my earliest appointments, the doctor said, "We're just going to treat you as a diabetic." And I was like, "I am not a diabetic." And they're like, "Well, you're going to fail the glucose test." I was like, "I'm not super comfortable with the idea of you treating me for a condition I don't have. So I don't really think this is maybe the place for me to get my prenatal care." So
You're like, I have enough conditions without you giving me a diagnosis that doesn't exist in my body yet.
yes, exactly.
Yeah, and another thing that stood out to us too while taking the class is that the hospital we ended up delivering at had a shared practice model. So there were both, every shift there was a midwife and an OB on call on the floor, which was really
huge. Yeah.
How did that process go then, switching your practice and the hospital? Was that easy or hard, or what was that like?
It was actually fairly straightforward. At least it felt fairly straightforward for us, who I'm very used to sort of dealing with juggling different kinds of like medical files and transferring doctors and all that kind of stuff. It does take a little bit of legwork, but it was basically looking up a different practice that was associated with the hospital that we wanted to be at, making a couple of phone calls, getting my records transferred over, and that was about it. And so just sort of something for others to keep in mind as they're progressing in their pregnancy or planning their pregnancy, where if you are not loving the OBs that you're working with, definitely bail on them and find a practice that's going to treat you the way that you deserve to be treated.
Mm-hmm. And I can see how that would help your anxiety then, to feel like you're finally with a practice that is listening to your concerns. Is that how you felt the second half of your pregnancy?
Absolutely. Yeah. And so I don't think I had my first appointment with the practice I ended up with until maybe 16 or 18 weeks. And just immediately, it was our first visit was a video call, and Anand and I were both part of it. And we ended that, and it was just like night and day. Immediately, just more confident in the way I was treated, the tone of voice, the thoroughness. And so that was huge, and sort of immediately mitigating a lot of that anxiety I had from the get-go.
So towards the end of your pregnancy, after having taken the childbirth class, you mentioned you were planning on having a hospital birth and that it would probably be medicalized, but what other aspects of your birth were you planning?
I think in my situation, there was not a lot that I had planned per se. With what we learned in the course, we sort of treated it, instead of having a birth plan, it was sort of more like a birth decision tree, where if A happens, then we'll go to B. And if B happens, then we'll choose between C and D and that kind of thing. And so I went into it trying to be as flexible as I could, because I didn't know what kind of surprises I would run into.
Anand, what were your hopes for the birth as the partner and support person?
My hopes were that everyone was going to come out healthy and happy, right? You hear so much about folks talking about trauma in their birth experience, and particularly in hospitals. And I just wanted everyone to come out well in all aspects. And that was really critical to me. Another thing that was really crucial, I think, that came out of the class is we were kind of on the fence about having a doula initially. And it really kind of, the evidence there really cemented our desire to have a doula. And, we connected with this amazing collective of doulas. And for the birth, we had both a very experienced doula and one who had just finished school and was doing her clinical experience time.
Yeah. So what did that add then to your preparation? Like, did you meet with your doula ahead of the birth?
We did. And so we would have some consultations with her. And I have to be honest, like Anand said, I really only opted for the doula because of the evidence, because it didn't seem something that was very me in terms of just kind of what I thought I would want, but the evidence persuaded me. And when we met with her, I just really sort of kept sticking to really practical stuff, like how do I prevent tearing, or when will you come meet me at the hospital? And Anand's finally like, you need to talk to her about your anxiety, which is really sort of what her biggest role was in the birth was, keeping my anxiety levels down, being a big source of support, normalizing the things I was going through, right? Where because I've never attended a birth and I've never given birth before, obviously, I didn't know, if my experiences would be considered typical or safe. And so having her presence there was also really huge in keeping me calm and happy.
Yeah, and I think that was really having that voice of experience. For almost 11 years now, I've volunteered as an EMT nights and weekends. And, in that setting, birth is always, it's always abnormal, right? It's always the complex, complicated things that we focus on. And to have someone who could be there and has seen it all before and helped all hundreds of women through that experience is just huge. So.
Yeah, it's funny. With my two youngest kids, they were asking to watch birth videos last night because it's been a couple years since I've showed them any, and I think they'd kind of forgotten. They had all these questions. So I picked out a couple videos from the library in the class that are kind of more gentle exposures to birth. And my kids got a little afraid. They were like, look at her. She looks like she's in pain. And there wasn't even a lot of yelling or screaming or anything like that. It was just like obviously super intense for the person giving birth.
Mm.
And I was like, but look at the midwife, because the midwife is just kind of squatting there at the edge of the tub. It was a water birth. I was like, look how calm that midwife is. The midwife is just soothing, calm, knows like everything is absolutely normal, just that kind of steady source of peace in the room. And I was like, look at the midwife's face. Like they're cool, they're calm, so everything's okay. There's something to be said for having that person, like you said, who's been there many times before.
It's so funny because the midwife who I saw mostly for my prenatal care happened to be the person who was there for my delivery just by chance.
Mm-hmm.
And she was so calm. I was obviously I'm in the middle of giving birth, so I don't remember this exactly, but Anand, do you want to share this fun story that you have of her?
She was an amazing practitioner. Early on in our time in the hospital, she called it the new building, and I realized when I looked later, the building had opened in the 1980s. So it gives you an idea of how long she's been delivering babies. And, we got to the pushing phase, and she's just kind of nonchalantly walking around. She's humming Hail to the Chief, the presidential anthem, while she's washing her hands. She takes a phone call while you're pushing, just completely nonchalant. And meanwhile, I'm looking around the room and the hemorrhage cart's coming in and people are preparing for the worst. And she's just this focus of calm there.
Mm-hmm.
It's
so important for both of your well-being as well. So let's back up just a little bit. I don't want to get too close to the end of the birth story. Share your birth story and how it began.
So I got to 40 weeks and we decided that we were going to do a scheduled induction, again, based on the evidence of, what is safest for older parents. And so I went in at 40-4, I think. So, yeah. And so they told us, get there at 6 a.m. and we drive there in the dark and we get there and an OB does an exam and he says, you're not really phased enough. Go home and then come back and we'll get you some Cervidil. And so I come back and a different doctor gives me an exam and he was like, well, I probably would have let you stay. And so I've already sort of spent 12 hours at home getting back into that headspace of I'm about to have a baby. And then we start the induction overnight.
The ripening overnight.
The ripening overnight, yes. And in the middle of the night, I'm trying to get some good sleep because sleep is also crucial in preventing seizures. And so I need to get a lot of rest because I'm about
So are you doing the ripening at home or in the hospital?
We're doing it in the hospital.
Okay.
Yes. And so I think that was part of their plan was we'll ripen you overnight so that you can rest during that and then sort of start labor in earnest in the morning. And overnight, I'm trying to get, my last good night of sleep before I go into labor. And there is a woman in the room, maybe next door down the hall, and she's having what sounds like the scariest experience of my life. Just like lots of screaming, lots of swearing. It does not sound like a positive experience. And then just this very sort of, I don't know, I guess old school coaching where this kind of countdown of 10, 9, to the pushing. It's like a rocket launch, right? And it just seemed so, it was not something that was great kind of going into what I was going into the next day.
Yeah, she's shouting swear words. It just sounded like
Yeah,
Yeah.
I had this moment, I'm listening to this at 3 a.m. going, I don't know that I can do this.
Mm-hmm.
And so in the morning, they start dosing me with Pitocin. I'm strep B positive, so I have penicillin. I know that the course sort of talks about the evidence behind that. And it was something that I opted to do because, again, we sort of played a lot of this on the conservative side given my circumstances. And so I've got that and a saline drip. And we're just sort of waiting for these contractions to pick up. They start upping my Pitocin. I'm starting, I get to be about 5 centimeters. People are coming in. It's like, you don't really sound like a woman in labor. And so we then rupture my membranes, and that really starts to get things going. But it's still pretty slow going. And they're just I'm so full of Pitocin. By the time, how much was I at?
I think we got up to 40 units.
40 units, something crazy like that.
Okay, so pretty high doses at that point.
Huge. Yeah, and so we get to late in the night. There's this really wonderful moment where the doula is trying to help me get more comfortable, and we're also sort of trying to help the baby descend a little bit more. And Anand and I are just sort of doing the slow dance, swaying in the hospital room. And it was just sort of another great reason to have a doula there. It gets to be maybe midnight, 1 a.m. I'm maybe 8.5 centimeters dilated, something like that. And the contractions are stronger, but help me with this, because this is blurry, too close together, not consistent.
Yeah, and so I guess one thing that we skipped over here is that earlier in the evening, probably around, I think it was before 8 o'clock, because I was grabbing dinner. I was out of the room at the moment. Perfect timing. The midwife, a midwifery student come in, and they come to you and they say, hey, we want to place a scalp electrode.
Yes.
We want to place, an internal contraction monitor, catheter. And there's actually a discussion between us about that, right? I come back and we talk about it, and we actually pull out the workbook, which we had with us from the EBB class, and start refreshing ourselves about the pluses and minuses. And we end up deciding that that's probably the right decision, and the student actually places the devices, right? Which I think also was one of those moments where the class really came in to help us as well.
Which makes sense if you're getting kind of these high doses of Pitocin to have the more accurate monitoring for your uterine contractions and everything.
Absolutely.
Yeah. The other thing I will say for this facility is they did have the wireless telemetry monitoring as well, which was, I think, huge for the early parts of that process.
Okay, so that's why you were able to be up, slow dancing and moving around, because you were on a wireless monitor.
Yes.
Exactly.
I did have an IV tree, next to me, but I did have some mobility there, which was great.
Okay. And you still hadn't gotten an epidural or anything like that at this point?
Not at that point. And so, what was that, 8.5 centimeters?
So what comfort measures were you using? I mean, you got to 8.5 centimeters in an induction with lots of interventions. That's a long way to go without any kind of pain medicine. So how are you, what were you using to stay comfortable?
Mostly the doula, I think, at some point that night, right? Because again, I think I was in labor for over the course of 3 calendar days. So there's a lot of stuff that I kind of forget sometimes when I'm telling the story. But the doula was doing some, I think, acupressure to help me. She used the rebozo on me, which was very therapeutic, really calming, sort of calming things to say. At one point, I will say that I had listened to the relaxation tracks that you recorded. And there was one that I used a lot through my pregnancy, the visualizing a forest. And so I took some of the parts of that and was just sort of repeating them in my head to sort of calm me down. So that was also another comfort measure for me as well.
Yeah, we tried different positions, which again, having the doula there to suggest positions that we actually learned in class, but to actually be why don't we try this now, was really huge. You tried a TENS unit, which helped for a while.
Yeah.
So it sounds like you had a full toolkit of a lot of different things you could use to stay comfortable. And you were at 8.5 centimeters and it was kind of the middle of the night, it sounds like. So what happened next?
At that point, one of the midwives is coming in and talking to me, and they're kind of persuading me for an epidural. And the thing about birth, right? They say you could probably do it, but you just don't know how long you have to do it for. And
so almost her exact words.
Yeah. And so it's just I kind of felt like I was probably getting pretty close. I felt like I could go for it. And it's you don't know if you're going to get to full transition or to the pushing stage in 20 minutes or in 6 hours. And so even if it does happen, you've been up for a long time, you need your rest, you're going to be too tired to push. And so I did get an epidural at like 1:30 in the morning, I think, just so I could get some sleep.
And how many hours had you been in labor at that point or been in the induction process?
They started me on the Pitocin at 6 a.m.
Yeah, 6 or 7 in the morning.
6 or 7 in the morning. And so it's 1 in the morning the next day.
Yes.
Okay.
And, thankfully, again, picking a facility that has more resources, it's a trauma center, the anesthesiologist was there in 10, 15 minutes, whereas, where we are in a rural area, they'd have to call them in from home otherwise.
Okay. And you hadn't slept really because you hadn't been sleeping that night. And the night before, you'd been awake listening to other people labor and doing the cervical ripening. So at this point, were you able to sleep?
I was. And I mean, I think for most people under any circumstances, like hospital sleep is not great to begin with. And so the epidural did help so that I could get enough relief from the contractions to sleep and get maybe a good 5 or 6 hours in there. Mm-hmm. And then in the morning, the contractions woke me up. And so I was like, this epidural is starting to wear off a little bit. And I've already got it, so I might as well use it, right? And so I'm pushing the button and like nothing's really happening. And so I think it sounds like I was maybe kind of saturated. And so the epidural didn't quite work anymore.
Yeah, something else that you woke up early in the morning too, and you were only numb on one side. And something that I don't think I was aware of from the class or even from the reading we've done is because you were lying on your side, all the analgesic medicine had pooled on one side, and the nurse had pointed out, hey, you just got to roll over. It'll help, which I think I wasn't aware of at least.
Yeah.
Yeah, I guess that's another reason we talk about when you have an epidural about moving from side to side every so often, preferably with a peanut ball. And that would also help kind of avoid the medicine from only going to one side. But it makes sense, though, you needed to sleep. So it's like you don't want to be interrupting you every 30 minutes to switch positions.
Right.
So you woke up with the contractions, and what happened next?
Help me with the ordering here. Oh, so I'm also saturated with Pitocin, right?
Yes,
and
yeah.
Okay, so you're desensitized to the Pitocin because you'd been having it for so long at such high levels?
Yes.
Mm-hmm.
And we were kind of really lucky. The nurse on the day shift that morning was also a doula and also the childbirth educator for that hospital. So our doula, the nurse, knew each other well. So there was really kind of a team dynamic there that was really helpful. But they cut the Pitocin and gave you
some
calcium antacids, Tums, which are all things to help clear that out, which I'd never heard of either. And then waited an hour and restarted from 2 units and worked its way up.
Yeah. So
that's really important for people to understand who are listening, that if you have Pitocin at high doses for a long time, the receptors start to, like you said, saturated, desensitized, and your uterus contractions will become irregular or not strong or weak. And there's different abnormalities that can happen. And it's really important to give your body a break from the Pitocin for an hour, like you just said, and then restart it at lower doses. It sounds like that's what they decided to do.
Yeah, that's exactly how they handled that. But of course, disheartening in the moment where we've been working so hard at this induction and they're like, we're just going to shut you off. Like, we're going to cut you off and start over. But I mean, of course, that was the right call, but it was not something I expected since we'd been working so hard towards progressing that.
It's a little counterintuitive, and some providers would just keep turning it up, right? And then say, well, you can't do this. We're going to do a C-section. So the fact that your providers and everybody knew to turn it off and follow the guidelines, that's really awesome.
Yeah. And I guess the other thing to mention here too is that the positioning of the baby was not great. The whole pregnancy he'd been transverse and just was not in a good position. And having a nurse who's a doula and our doula and the midwife, they were all kind of conferencing and saying, why don't we try this position? Why don't we, why don't you lie in this position? Let's try hands and knees, right? All that back and forth. And that kind of collaboration was really huge, I think.
Yeah.
So you had a break and they're dealing with the baby's positions and then they turned it back on slowly. And what was going on then?
At one point, we had a heart rate deceleration. And again, we wanted the heart rate monitor just because we wanted more data to work with. And he had been like really strong and super stable throughout the whole thing. And so that one little blip really kind of like spiked my panic. And so,
and it was during a cervical check. So the midwife reached in and stimulated his scalp, and thankfully it came right back.
Yeah.
But it definitely gave everybody a little moment of panic.
Yeah, particularly because I've been, in labor for so long. And so everybody kind of cleared out so that Anand and I could have a discussion. And I'm sort of sitting there thinking, like, maybe, I don't know if this is going to work. Like, maybe we just go for a C-section, because I'd rather just do it now if we're going to move into like emergency C-section territory. I just want what's safe for everybody. I don't want it to be traumatic. And we were really sort of talking about that. And then I think that's when the midwife came back in and the doulas came back in. And they're like, let's just give this one more shot.
And it's tough because the lip of the cervix had just been stuck on his head for so long every time.
So you were like so close to 10 centimeters, but hadn't reached it yet.
It was like 9.5 or something for several hours.
Yeah, for a good chunk of the day. And we later find out, and talking about the shared practice model again, that there was kind of a heated nursing station conversation between the midwife, who's been doing this for decades, right, and the OB, who's relatively young OB, relatively early in his practice. He was advocating just to go to the OR and have a C-section right away. And the midwife said, I think we've got this. And I guess she won out the conversation. But
it's so funny, those nurses station conversations that most parents never hear about, but it can be enlightening to find out that all of this was happening kind of outside your perspective, and the midwife was advocating for you and stood up for you. Yeah.
Yeah, no, it was really great. And I like to think too that she was doing that because I saw her for most of my appointments. And so she knew who I was and knew sort of my profile and felt like she knew what would be safe for me as well, just through that familiarity with me and my background. And so I was just really happy that she advocated for that for me.
So when did you reach 10 centimeters? Like, when were you able to push?
It must have been pretty late into the afternoon, because once we got to the pushing stage, that baby was out in like 25 minutes.
Oh, okay.
Yeah, so it's just sort of a lot of lead up.
I love this. I think she's got this. Let's give it a try from the midwife. And then you push for 25 minutes.
It's just, So,
yeah.
And I actually really expected that to be like the most horrible, scary experience, because that's, I think, what I was hearing in the next room over in the middle of the night a few nights before that. And it was just really, I don't know, I felt really calm. I remember like between pushes, just sort of asking Anand if he was okay, asking if the baby was okay. Like I just felt sort of in like a very calm kind of zone. I felt like I had really good focus in pushing this baby out. And that really shocked me, given just how much anxiety I had surrounding the pregnancy and the birth, sort of on and off throughout the whole process. So that was kind of incredible.
Yeah, and meanwhile, because you've been on Pitocin for so long, in the background, the room's filling up with people and they're preparing for a massive hemorrhage and all sorts of worst case scenario stuff. But nobody kind of clued us in. I had kind of a sense, having worked in emergency medicine a little bit, that there was that going on. It was such a dichotomy of sense there. And the other thing I'll say too is that it really was not this like shouting countdown pushing. It was really directed by you. Right. And they kind of got you started, and afterwards you really were directing this.
And how much were you able to feel while you were pushing? Because you had the epidural. Like, what position were you pushing in? Were you able to feel much?
Yeah, so I definitely felt a lot. And so I think I felt more in terms of contraction maybe than during the pushing part of the actual birth. But it was definitely like really pretty intense. So
yeah, and I think the way the epidural was placed, you were able to move your legs the entire time with the epidural. They didn't actually put in a Foley catheter until 8 or 10 hours into you having it. So you had a lot of function left there.
Yeah, it was definitely very surprising in terms of like what I expected for an epidural, where I just sort of figured I'd feel absolutely nothing and not be able to move my legs. And I was able to like really reposition myself. I was definitely hands and knees an epidural. So I don't know how much was at play there, but definitely a lot of sensation.
And then before you knew it, the pushing was done. And what was it like giving birth to your baby?
It was just so amazing, where it's this culmination of all of this work and all of this preparation and research and diligence. And it was just really incredible. And they had me use the squat bar and just sort of like have me put my feet up on it. And I'm doing, tug of war with this sheet. And I have people sort of holding my legs up with me. And like Anand is one of them. And it's just like this really amazing experience. And it was not at all what I expected my birth to be like. And granted, I have like 100 things coming out of me. I've got the epidural, I've got IV full of different stuff. I've got a catheter. I've got the scalp electrode, the contraction monitor. Like I'm connected to a lot of stuff. And yet I still had this really incredible sense of like, my birth is normal. My birth is this kind of really deep, intense, collaborative, safe experience. It was amazing. And then sort of this snap moment of like, here's your baby. He's on your chest. Like you're a parent now. So yeah, it was just kind of wild.
Why do you think you felt so powerful, even though it was such a high intervention birth? Like, what was going on in that room that made you feel so powerful as you were birthing your baby?
It's so hard to describe, but it was just, I felt this kind of confidence in what my body was capable of in a way that I don't know that I've ever felt before. And it was just so, like healing and empowering, but also this kind of connectedness at the same time where like, I'm sure other people say this too, where like, it's a very particular, just intense kind of connection with your partner. I felt this kind of really deep trust and appreciation for my care providers there. I felt like I was genuinely safe and cared for, which is not, again, given my history and unfortunately other people's experiences, not always something people feel genuinely from the people who are responsible for their care. So I think all of that is wrapped up in the positive experience that I felt.
And Anand, what about you? What kinds of thoughts and feelings were going through your head?
I was just standing there holding your leg and just standing there in awe of the amazing thing you were doing and how unexpectedly overwhelming that experience was as watching the baby crown and be born. And also just in awe throughout this whole process of how you knew exactly what you needed and what you wanted and how you communicated those needs and how you really were the master of this process as much as you could be. And that was just wonderful to watch and just really absolutely in awe, right? And we get to this pushing phase and you're directing the pushing. At the end, the midwife said, in her kind of quasi drawl, right? Hang on, you got to slow down or you're going to tear or something.
You're going to have one heck of a tear.
Yeah, that's exactly
it's
what
like, okay, I'm going to hold back a little bit then.
Yeah, it's just, I just in absolute awe at what you did.
So,
yeah.
It sounds like it was a bonding experience as well for both
Absolutely.
of you, kind of like cementing your bond.
Yeah.
Yeah. And it was so funny after the baby's born and we're all just bawling, crying, doula snapping some photos, baby's on your chest, right? And I've cut the cord and all this. And the midwife turns to your primary nurse of the day and just says, "Isn't it nice when there's no screaming and swearing?" It's just like offhand comment between them. And just baby.
And those birth experiences are very legitimate.
Of course.
We're not
Absolutely.
demeaning people who do have that response,
Absolutely.
but it is also, I think people think that that's what birth has to be like when it can present in all different kinds of ways. And it sounds like you were finding a peace during your birthing experience and strength and calm that you didn't necessarily expect because you had so much anxiety. So it's really cool that you were able to draw on that strength and all the skills you've learned of centering yourself.
Yeah, I mean, I fully expected to have one of those kinds of births that are very loud and very animated. And I think, of course, that is absolutely a valid experience to have while having a baby. I think it just surprised me that I did have that kind of different experience. And it just kind of, I expressed it differently. And that really did surprise me about myself. So,
and particularly with the depth of the anxiety you'd expressed leading up throughout the pregnancy, right? Just how concerned you were about the whole process.
Oh my God. I mean, I was talking to my therapist about like, I'm afraid I'm going to die in childbirth, like that level of anxiety. And so it's just like having this toolkit, having the evidence and the going forward with getting a doula, just knowing how to make informed choices where I went for just about every intervention that the course talks about. And I was very happy with that. But I don't know that I would have known how to make those decisions had I not learned about all of them in advance. So huge.
Absolutely.
And like knowing what you're getting into instead of being surprised or just kind of being forced into things. It's like you chose each intervention along the way. And I think that makes a difference, having a choice.
Absolutely. Yeah.
Yeah, and having a team of providers who
Mm-hmm.
give you the choice, give you the time to discuss that, and weigh the pros and cons was huge as well too.
Mm-hmm.
We'll be back in a couple minutes. You guys can talk about it, right? It's huge.
So I love that you were able to share with our listeners, how you can experience something like a high risk pregnancy and high intervention birth and still leave birth feeling empowered and strong. Do you want to share what your postpartum experience was like? Do you have any stories or info about that for our listeners?
I think the immediate postpartum experience was just like very much a blur. Um, our son had elevated bilirubin and also some signs of possible infection. And so that was kind of stressful. And so he was at points kind of like taken away from us. We had all of these heel sticks to get his blood drawn, and then something would happen to it. It would like clot or something before it got to lab. So he's getting his heel stuck like 100 times. And this is my, 18-hour baby. He's like 18 hours old. So that was kind of difficult. But with regards to my own recovery, it was really smooth.
Yeah, and with some of the medical stuff you do have, right? Like pretty early on, you seemed a little bit. Your words were you felt drunk, right?
I did, because the amount of anti-epileptic drugs that I was on, I didn't need it anymore because my blood volume went back to normal. I didn't have a baby in me anymore. And so I'm on this ridiculously high dose of it. And the nurse is asking me questions and I'm kind of slurring. I don't really know how to express myself. I try to get out of bed and I'm thinking like, oh, this is maybe not safe. So that was the other thing, was just sort of like trying to coordinate how to get my dose back down safely.
Yeah, contacting your neurologist and getting that figured out.
Yeah.
Oh, that's good to know though, for someone with epilepsy or seizure disorder. There's that adjustment period right after you have a baby that's kind of important for your medication levels and stuff like that.
Yeah.
So Lisa and Anand, do you have any advice for people listening who are planning on entering birth or parenthood soon? Any words of wisdom?
If they don't plan on taking the class, they definitely should, because that was, again, like really just enormous for us. Don't be afraid to fire your doctors if you don't love them, because it makes a difference. And I think everyone deserves to have a practitioner that takes them seriously, that genuinely is invested in their well-being and the well-being of their baby. I think too, it was a really interesting experience for me because pregnancy is kind of like a masterclass in taking up space, right? Where like, if you're not really good at that yet, for me at least, I found it a really good excuse to get good at that, and just sort of insisting on the things that I needed and that I knew that my baby and I needed. Whereas I don't know that I would have really known how to do that prior to being pregnant and having to figure out how to advocate for myself. So
yeah, and I think for me, after that we were surprised in your first go around with pregnancy, right? I think being prepared in every way we possibly could and seeking out, again, taking up space, what we needed to be as confident as we could be in this process, right, was huge. Seeking out the right specialists and the right practitioners and having that ready. And the other thing that was huge was having a doula, right?
Yep, get a doula.
It was, like you said earlier, right? It was this decision made kind of based on the evidence and on the rational, scientific based outcomes. But it was such an important element of how this proceeded, and just having that experienced, centering, touchstone presence was just so huge for everybody.
Yeah, get a doula even if you don't think you want one. Seriously.
I love how you say, yeah, there's the evidence and then there's like the experience of having the doula. And you're like, oh, that's why they're so effective, because
Yes.
they affect your birth in so many different ways.
Yes.
Yeah. Well, Lisa and Anand, thank you so much for coming on the podcast and sharing your story. I know it's going to be really inspiring for any expectant parents out there, especially who are listening.
Thank you so much for having us.
Yeah, thank you so much.
All right, everyone, that wraps up our interview with Lisa and Anand. Thank you so much for listening to their story. It was really empowering and inspiring. Just as a reminder, tomorrow starts our free trial for the evidence-based birth professional membership. So make sure you're signed up on our email list at the homepage at evidencebasebirth.com. You can also get to the free trial by going to evidencebasebirth.com/membership. This opportunity is only available through July 18. And as a reminder, you will get 14 days free in the trial and then 20% off the membership for as long as you choose to remain a member. Thanks, everyone, and we'll see you next week. Bye. Today's podcast was brought to you by the Evidence-Based Birth Professional Membership. The free articles and podcasts we provide to the public are supported by our professional membership program at Evidence-Based Birth. Our members are professionals in the childbirth field who are committed to being change agents in their community. Professional members at EBB get access to continuing education courses with up to 23 contact hours, live monthly training sessions, an exclusive library of printer-friendly PDFs to share with your clients, and a supportive community for asking questions and sharing challenges, struggles, and success stories. We offer monthly and annual plans, as well as scholarships for students and for people of color. To learn more, visit ebbirth.com/membership.